About H1N1.
An increase in disease again.
This isn't the flu that we're used to.
The message from the CDC today was clear. The H1N1 virus is here to stay, and it could be dangerous.
We've had outbreaks through the summer, and we saw the same virus causing disease in the southern hemisphere. We're expecting a lot more disease in the fall.
And yet officials here defended the schedule for the nearly $2 billion H1N1 vaccine program, insisting that it will be safe and effective. They were skeptical of the presidential council's call to begin vaccinating in September, 1 month early.
We still think mid-October is a good target for the major production to roll off. It is possible that some of the companies could accelerate that.
Health officials are concerned that the H1N1 flu could peak in early fall because most infections are among young people and they spread the virus very easily.
When school starts again, there will be the likelihood that those folks that are most likely to get in H1N1, the school-age population, they'll be back together and you'll start seeing an increase in disease again.
This session will begin with...
Today, CDC doctors said this year's flu season presents a unique challenge, an H1N1 flu season with many young people sick in the fall, followed by the regular seasonal flu in the winter that strikes the elderly particularly hard.
We need to be prepared for both. The only thing that's certain is uncertainty.
Dr. Richard Wenzel has tracked the H1N1 virus since it emerged this past spring. He traveled the last few months during the winter season in the southern hemisphere. The virus itself has not changed, but he found its symptoms mysterious.
In a number of countries, maybe 30% of the patients on admission had no fever. This is unusual in influenza. In Chile, 50% of the outpatients had no fever. This is unusual.
The CDC said today that the H1N1 virus spreads much more easily by touching rather than by coughing or sneezing like the regular seasonal flu. So simple things like washing your hands, Katie, could really be important, especially in slowing the spread of this virus until the vaccine is ready.
And Jennifer, I know today Secretary of Health and Human Services Sebelius estimated it would take until Thanksgiving before a significant number of Americans are immunized. Why so long?
The whole process, Katie, takes about 5 weeks. They're estimating now that 2 doses will be needed 3 weeks apart. And then 2 weeks after that for the vaccine to really take effect. So if the process starts in October, it won't be finished until 5 weeks later, which brings us to Thanksgiving.
All right, Dr. Jennifer Ashton reporting from the CDC in Atlanta tonight. Thank you, Jennifer.